James Mah. I'm at the University of Nevada, Las Vegas. There were many aspects of orthodontics that attracted me. One is the diagnosis and treatment planning. The second is dealing with and understanding growth and development. And the third was I was fascinated by the various biomechanics and the principles behind them. It was really intriguing to me. For me, if you asked me, my answer would have changed from when I started as an orthodontist to today. What it means, over the years, I would say it's actually a gateway. It's a gateway for access to technology. As you know, orthodontists have been a spearhead for many of the technologies that we have in dentistry today. It's also the gateway to business, practice management, employee management, and of course, a very unique type of patient care. So it means many things to me. It means much more to me now than I did when I started the field of orthodontics. Equally, it means a lot. On the first pass, people think orthodontics is about alignment of teeth, but if you look at it, the deeper implication, what it means is it means confidence. It means a sense of pride, a sense of belonging. We hear horror stories about bullying and people feeling that they don't belong. And I think, while we're in a, dental and aesthetic perspective, I think the other business we're in is societal impact. I'd say there's a couple things. One is, and maybe what got me into orthodontics is I like to tinker and deal with mechanical things. So I do like to wrench on cars, particularly muscle cars. That's one thing. And the second thing is, one of my hobbies is to get into intellectual property and write patents. I think the actual most difficult case doesn't really have to do with the biomechanics or anything like that. We have access to so many things and so many approaches now. The most difficult case to treat is the type of patient that has a misunderstanding. The patient or the parent just doesn't accept what is there or has unrealistic expectations. You just can never get there. Whereas even the most difficult cases, we have access to TEDs, other appliance systems, surgery, and so forth to treat. It's actually treating the individual that's the toughest part. In a word, technology. And technology comes at us in many ways, even from the electronic patient record. I was in the era of paper charts, stone models, and now we have digital impressions, even, customized wire bending systems, and of course, cone beam CT and aligners. So it's exciting, but there's a lot of changes, and it's all due to technology. I think orthodontists will continue to do well, but I think they're going to need to expand their horizons. We're already seeing that in many countries where orthodontists are playing a major role in management of sleep apnea. Is one area, and getting into a little bit more of the facial aesthetics as well. So I think that the future orthodontist is going to evolve a little bit and be more than just the traditional fixed appliance systems. Oh gosh, that's so many years, and I'm going to bring up some names that are blast from the past, Phil. Larry White. Back in the time, I think Peter Sinclair, they asked me to be a reviewer. And I started becoming a reviewer and getting involved. And at some point, I think folks like Ron Redmond, Bob Keim, they asked me to be technology editor. So I got more and more involved with the JCO. But gosh, we're bringing back names from over 25 years ago. JCO has been an invaluable source of information sharing for clinicians to see what's going on, to have the type of studies that are easily understood by clinicians. And if you ask me what journal do I read the most, have the most eye time reading, it's the JCO. That exact thing. It's been a great avenue for dissemination of clinical information. I think there's many sources online. A lot of it is a bit more, I guess, complex and more of a difficult read. JCO's got it in a nice package, easy to understand, and people really enjoy reading it, I think. Yeah, it kind of maybe is more centered. So on one hand, you have the social media, which is no peer review, no data, high opinion, and there's room for that. I mean, there's always room for opinions, but on the other hand, you have journals and uh, that are I could say more academic. It's a thick read, and for a lot of people, that's a challenge. So I think JCO is very centered in the mainstream of what a clinician would want as far as a reputable journal, something that is they can count on and rely on the information in that journal. Oh gosh, there's so much. It's hard to say there's one thing, but it's all things. I remember reading the practice management series with some zest and thinking, wow, this is really great. I can't find this anywhere else. I've picked up biomechanical tips and tricks and, lots of studies that have to do with technology. So I can't say a particular thing, but as an embodiment, I've learned so much from the JCO. As far as the subscription, I think again, it's an invaluable resource to put it all in one package and you get it every month. That's fantastic. So if everybody, if people or clinicians are going to want to maintain a certain up-to-date current standard adopter of technology, JCO is a great source, and it's I'd say very reasonable cost to get this information. So I think it's great value to practicing clinicians. Well, I wish I knew then. Obviously, this is the crystal ball that everybody wishes they would have at one point. But I wish I would have known all the opportunities that were available in orthodontics. I mean, we learned them. We learned them at going to meetings, interacting with colleagues. But I wish that I knew about the tremendous innovation, the tremendous opportunities available to orthodontists back then. Yeah, as far as advice for practicing orthodontists, it's always good to be working, but I would say take a minute to, get away from the nose to the grindstone type of approach. Just look around. The world is rapidly changing. Consumer practices are changing. Technology is changing. Just take a breather and look around and see what's going on. Best advice for residents would be to be present. You really have, in any program, you've just learned the fundamentals. I would encourage residents to be there as much as possible, like a sponge, soak up everything, and even the things that you don't think you'll ever use, skills that you think might be antiquated, embrace those, get used to them and understand those, because I think one of the things that's carried me a lot, quite far in my career is being able to apply concepts from one topic to another, and then you have a solution. So the more you know and the more you experience, the better off you are and the better prepared you are for private practice. Yes, I've thought about that a lot. It really has to do with picking the best tool for the job, specifically the deep bite cases, the class 2 div 2s. We have many ways. We have intrusion arches. We have a number of biomechanics to treat them. The single easiest thing is I use a thermoform bite plane. Anybody with a deep bite, have them wear a thermoform bite plane, which is very inexpensive to make. for about 3 months, and it resolves your deep bite problem, and then you can treat it like a normal overbite relationship type of patient, which makes it a lot easier rather than fight with it with intrusion arches or leveling arches and that for months. And I really use that today as a go-to.